Hello students, welcome to the fourth video lecture for healthcare ethics. This is the lecture for week 13 and it covers Rachel Aviv's 2018 article, The Death Debate, which was printed in the New Yorker, and Michelle Goodwin's 2018 article, Revisiting Death, Implicit Bias in the Case of Jahi McMath, which was printed in the Hastings Center Report, which is a very good resource for bioethics articles. I've added Michelle Goodwin's article because it introduces an important term that I'm going to discuss later in the essay, which is implicit bias. I've also included a third article by Arthur Caplan on the Blackboard site, but you don't have to read it. Arthur Caplan's article was published in 2014, and I've included it as another example of an op-ed, and simply so you get the other perspective, the alternate perspective on the McMath case from the perspective you get in Rachel Aviv's article and Michelle Goodwin's. That said, the article that you should focus on, the one you should spend most of your time on for this week, is Rachel Aviv's 2018 article. So before we examine the content, we're going to take a minute to consider this article from a formal perspective. We are reading this in part because it is an example of an op-ed. And you guys are writing op-eds. What a coincidence. So although this piece is much longer than the pieces you will be writing, it does several things that you want to do. First of all, it tells a story. Second, it connects that story to larger ethical issues. This occurs in Aviv's article most explicitly in the middle section on the history of brain death as a concept. So it tells a story, it connects that story to larger ethical issues, and it cites expert sources. These are all things that I'm going to be looking for in your op-ed pieces when you turn them in on May 15th. The other article that we're reading for this week by Michelle Goodwin, which I apologize wasn't originally on the syllabus, but I think it's important and it's short and useful. Goodwin's article has a very different tone because it was written for a scholarly audience of bioethicists rather than a public audience. Yet it conveys important information in the terms we have been discussing in this class. The concept of implicit bias, a concept that we haven't discussed yet in this course, is important because it is the main concept that bioethicists use to understand systemic inequalities in healthcare. And that's an issue that's come up for us a number of times, and it's a major issue in contemporary healthcare. So as always, there is a worksheet to accompany the readings and the lecture for this week. This worksheet, the worksheet for week, what week are we? Week 13. Is due on Friday, May 1st. In addition to the questions about the readings, this week's worksheet contains a component of our op-ed assignment. So last week you guys looked up at examples of op-ed pieces, and this week you have to write a pitch for your own piece. The pitch is explained in the worksheet, so I'm not going to go into great detail about it here, but what I'm asking for is just a couple of sentences explaining what you are going to write about and why it matters. A clever title wouldn't hurt too. Okay, so let's move on to the content of the articles that we're reading for this week. So this is the story in the McMath case of a teenage girl who died twice. Once in California and once in New Jersey. So the story begins with a 13-year-old black girl from Oakland, California, who underwent a tonsillectomy as a treatment for sleep apnea. The surgery went well, yet the patient experienced significant post-operative bleeding. The family alerted the nursing staff and attending physician to the patient's condition, but she continued to bleed. And eventually, she reached a crisis. Her heart stopped. By the time the medical team was able to restore her heartbeat and stabilize her breathing, Jahi had experienced significant brain damage. She was declared brain dead, which in California means legally dead. This is true in most states in the Union. So she was declared dead. The hospital staff urged the family to cease artificial ventilation and allow Jahi to die physically as well as legally. The family refused. They got a lawyer involved and eventually got Jahi transferred from California to New Jersey, which permits a religious exemption to the legal status of brain death. The state of California issued a death certificate for Jahi McMath on January 3rd, 2014. On January 5th, Jahi was admitted to St. Peter's University Hospital in New Brunswick, New Jersey. Her mother, stepfather, and sister all moved to New Jersey. Jahi remained on a ventilator for 4 years, first in a hospital, then in her family's new home. Meanwhile, her family mounted various lawsuits on her behalf against the hospital for malpractice and against the state of California to allow her to return home. On July 22nd, 2018, several months after Aviv's article was published in the New Yorker, the state of New Jersey issued another death certificate. Jahi died again from complications associated with liver failure. So what is at stake here is brain death versus cardiopulmonary death. Cardiopulmonary death is simple. The heart stops beating, the lungs stop working, the body dies. Brain death is a legal definition of death that is valid in every state in the Union, period. There are 2 states that permit religious exceptions to this concept. Those are New York and New Jersey. But brain death is a valid legal definition of death in the United States and most of Europe and the world. And it evolved out of a bioethical definition, which declares the body dead when the brain ceases to function. It is, according to philosopher Peter Singer, as Aviv quotes on page 35, it is an ethical choice masquerading as a medical fact. The medical fact is the measurement of brain function. We can accurately, clearly, and concretely measure when brain function has ceased. The ethical choice is whether or not the body dies without the mind. So why does brain death matter to bioethics? We will return to this question, but we can see that it matters very clearly from the vehemence of the responses of bioethicists to the case of Jahi McMath. So I'm going to quote, for example, from Arthur Caplan's op-ed, which was published in 2014, around the time the case began. And he writes, "To keep Jahi's body on machines is ethically wrong because definitive brain death is death, and maintaining a corpse by artificial means is only slowing the inevitable decay and collapse of bodily remains. Later in the piece, he writes, "It is wrong for healthcare providers to treat someone who is dead. It is wrong for lawyers to ask judges to overrule medical expertise when it is doctors, not jurists, who know when death occurs. It is immoral in the extreme not to try to get Jahi's parents to come to terms with her death. Immoral in the extreme." Note the tone here. Note the confidence of the assertions. There is a great vehemence that indicates a great importance, a great investment in the concept of brain death on the part of bioethicists. So a number of the authors that we have read already in this course are cited in the article. Besides Arthur Caplan, there is Robert Truog and Thaddeus Pope. Generally, the bioethics establishment sided with Arthur Caplan against the family of Jahi McMath in asserting that brain death is death. Okay, so now that we know the two positions, roughly, what are the ethical issues at stake in Jahi's case? So the biggest one to begin with that we have covered is the question of surrogate decision-making. So surrogate decision-making attempts to preserve patient autonomy when the patient has lost decision-making capacity. So this very same Thaddeus Pope, in the essay that we read by him earlier in the course, writes, quote, "Losing capacity does not mean losing autonomy. Our society's individualistic norms place such a strong emphasis on the value of the patient that medical decisions should continue to be guided by that voice, that is, the voice of the patient, as much as possible." So Jahi's mother acted as her surrogate decision-maker when her daughter lost decision-making capacity. It was her responsibility to make decisions for her daughter as her daughter would have wished. So as you guys wrote on your exams, and as Pope wrote in that essay, surrogate decision makers are expected to follow three standards: the subjective standard, then the substitutive judgment standard, and then the best interest standard. So first, the surrogate executes the patient's expressed wishes. This is the subjective standard. So if the patient left an advanced care directive, for example, or do not resuscitate order, the surrogate is required to enforce that order. If there are no expressed wishes, then the surrogate substitutes their judgment of the patient's wishes. So they, quote, "decide in accord with the patient's preferences and values," end quote. So in this case, the surrogate is responsible for doing what the patient would have wanted. If and only if there is no way of knowing what the patient would have wanted, then the surrogate decides based upon a general abstract standard of best interest, which might be the standard evoked by Arthur Caplan and the rest of the bioethicist establishment in asserting that Jahi McMath is a corpse. Nonetheless, in this case, Nyla justifies her decision in her daughter's case based upon a mix of expressed wishes and substituted judgment. So if you look on page 36 of Aviv's article, the New Yorker article, so this is page 7 in the PDF, in the top of the right-hand column, the article describes a conversation in which Nyla explained to her children what a ventilator is. She'd been teasing them, saying, "I'm going to run your business for the rest of your lives." When her son bragged that he'd outlive her, she joked, "Well, I'm going to get put on a ventilator. Jahi had never heard the word before and asked what it meant. It's a machine that keeps you alive, Nyla explained. She told me, I'll never forget. The rest of the kids laughed, and Jahi said, well, if something ever happens to me, make sure you keep me on one of those. So Nyla remembers an expressed wish on her child's behalf to be kept alive on life support, and she insists that this is what Jahi would have wanted. So why then did Arthur Caplan write in that same op-ed? Jahi's parents must be experiencing horrible pain, but their wishes for medical care should not be honored. What overrules the principle of patient autonomy here? So I'm going to read you guys another quote. It's on page 33 through 34 of the Aviv article. And it's a quote that invokes explicitly the role of a bioethics committee, something we've talked about before in this course. So starting in the bottom right-hand corner of the page 33, Nyla asked Children's Hospital to perform a tracheotomy, a surgery that enables ventilator air to be pumped directly into the windpipe. So this is when the family is initially trying to get Jahi moved out of Children's Hospital, where the initial surgery was performed. The hospital's medical ethics committee unanimously concluded that the intervention was inappropriate. Quote, no conceivable goal of medicine, preserving life, curing disease, restoring function, alleviating suffering, can be achieved by continuing to ventilate and artificially support a deceased patient, they wrote. They said that the doctors and nurses caring for Jahi were experiencing tremendous moral distress, and that accommodating the family's requests would raise significant concerns of justice and fairness. So there are two versions of justice at stake here: social justice and distributive justice. Social justice is the kind of justice Jahi's family argues when they say that they have been discriminated against by the hospital. Distributive justice is the kind of justice the hospital ethics committee cites when they refuse to honor Jahi's family's wishes. Jahi, according to the ethics committee, is using scarce resources that should be given to other patients. Think about the argument for distribution of healthcare resources based on capacity to benefit. Jahi, according to this argument, had no capacity to benefit from artificial ventilation because she was brain dead. So why do bioethicists care so much about brain death? Because it is a necessary component of the current understanding of distributive justice. So think back to the case of ventilator rationing. We're going to return to the question of social justice at the end of this lecture. But for right now, we're going to talk about distributive justice. So last week, we were talking about ventilator rationing in terms of distributing ventilators in the case of a pandemic based on the capacity to benefit. So ask yourselves this: should Jahi McMath get a ventilator that could go to a COVID-19 patient? In truth, this question is slightly misplaced. The New York State Department of Health guidelines don't actually allow for extubating long-term ventilator-dependent patients in the case of a pandemic shortage. They don't allow for this basically because it would be inefficient. It would cause more harm than good. Long-term care facilities aren't ICUs, and they don't have the capacity to care for patients in acute respiratory distress, and taking ventilators from nursing homes to hospitals wouldn't actually do all that much good to alleviate shortages, but it would cause a lot of pain. So ventilator-dependent patients don't get subject to rationing unless they're in the hospital, and when they get to the hospital, they're treated like any other patient in need of a ventilator. So even though this isn't really a situation that would occur, the question raises the primary concern of bioethicists in this case. So should Jahi McMath get a ventilator that could go to a COVID-19 patient? Healthcare resources are finite and should be distributed to those who can benefit from them. So the argument of distributive justice goes. In addition, there are other elements of this argument that get applied in the McMath case. Caplan worries that other families will follow the actions of the McMath family, and then hospitals will be overwhelmed with ventilator-dependent brain-dead patients who take years to die. He writes, "It's not cheap to occupy a bed in an intensive care unit, as much as $7,500 a day. So the chance that more beds might be occupied by the dead, surrounded by families armed with court orders waiting for miracles, would add stress to an already overstressed system, already overstressed hospitals." Whether or not that's a likely outcome is debatable, but this worry shows up several times in the article, and not just in regard to ventilators. Thaddeus Pope is quoted as saying, "Every hour of nursing time that goes into one of these dead patients is an hour of nursing time that didn't go to somebody else." So again, here is the theory of finite health resources that need to be distributed equitably. There is concern that Jahi's medical bills were being paid by Medicaid, so even finite health dollars. Now that's a different set of concerns altogether, but it's worth noting that there's lots and lots of room for racial discrimination as argument, which we will turn to in the end of the lecture, and the question of Medicaid really brings it to the fore. The idea that some people are benefiting from society who other people don't want to benefit, that our tax dollars are at work supporting some Black lady whose baby has died but she doesn't want to admit it, that is the concern of social justice. But it is masquerading as the concern of distributive justice. Okay. So, organ donation. This is the other concern of bioethicists, and it's related to the question of distributive justice, although it's really weird to think about organs as healthcare resources that need to be distributed, but in fact they are. So it's a thing we haven't talked about very much in this course, and we're not going to talk about it all that much in this course, but it is a favorite issue for biomedical ethicists. You might remember that the Caplan article we read for last week mentions organ donation as an example of healthcare rationing that's already in effect all the time, but it's actually a really minor aspect of contemporary healthcare systems. It's just a small part of the big system, but it's a ethically compelling case that bioethicists like to spend a lot of time discussing. The concern here is that disregard for the concept of brain death will cause surrogates to decide against donating organs because it will create a false hope of miraculous recovery. It shows up in the Aviv article on page 40, which is 11 of the PDF in the top right-hand corner. Pope worries that these disputes, which often get media attention, will cause fewer people to register as organ donors, a practice whose social acceptability depends on the idea that patients are dead before their vital organs are removed. Aviv even worries that her article could discourage organ donation. If we agree that organ donation is a good thing, the argument goes, then we need brain death in order to understand how a body can have good working organs and not be alive. So the McMath case sparked a serious debate about the concept of brain death, which you see reflected in the New Yorker article. But it also raises an important issue discussed in Michelle Goodwin's article of bias in healthcare. And this returns us to the concept of social justice. So, implicit bias, which you are asked to define in your worksheets, is basically another word for racism. So it's a term we can contrast to explicit bias, which we can think of as the outright visible forms of racism. Implicit bias refers to the idea that some discrimination is unconscious. So we all hold biases against others. Racial, gendered, religious, sexual, cultural biases that change our actions in ways we are not aware of. Some of this occurs on a macro level. So the historical accumulation of racial discrimination influences where we live, where we go to school, what kind of jobs we work, how much money we have, and this, in turn, produces different health outcomes in different racial and ethnic groups. But implicit bias also works on the micro level, on the level of individual patients and providers. So both articles quote Jahi's mother as saying, "No one was listening to us." So this is referring to the initial situation after the surgery when Jahi was bleeding and no one was listening to the family. No one was listening to us. And I can't prove it, but I feel in my heart that if Jahi was a little white girl, I feel we would have gotten a little more help and attention. So Goodwin argues in her article that we read for today that the issue that matters here is not whether or not Jahi McMath should have been kept on a ventilator for 4 years after being declared brain dead. The issue is that she should not have ended up in a situation where she was declared brain dead in the first place. So think back to the story of how she ended up ventilator dependent. Why did the medical staff fail to respond to Jahi's post-operative bleeding in a timely manner? Implicit bias is Goodwin's answer. So I would like to register the case of Jahi McMath as a protest against systemic inequality. In challenging the concept of brain death, Nyla McMath challenged the definition of death within a system that produces the deaths of Black people at much higher rates than the deaths of white people. The operation of racial bias in healthcare defines the ailments of Black people as less important, less worthy of attention and resources and treatment than the ailments of white people, and thereby defines the death of Black people as less important than the death of white people. This is what systemic inequality means. By refusing the death of her daughter, Nyla McMath refused that system. So this does not mean that the answer is allowing brain dead people to stay on ventilators. Nyla McMath's protest is a protest that should be honored, but it is not one that should have been necessary. The answer is changing the pressures of racial bias that are ingrained in our healthcare system, changing the social and economic structures that disadvantage communities of color, and changing the attitudes and behaviors of healthcare providers towards racial minorities. And that's what the second article that you guys read for today argues. So I'm going to tell you this here because I'm not sure you're going to get it anywhere else in your education, and I think it's really important. This is an insight that comes largely from the humanities, but it's one that really, really matters in the case of healthcare ethics. So race is a social construct. Let me say that again. Race is a social construct. It is a biological fiction. It is a system for codifying the enormous array of human genetic and phenotypic differences, the vast and unimaginable amounts of differences between human beings, a system for codifying those differences into clearly delineated groups and hierarchies that was developed in the 18th century by European intellectuals. It is astonishing that we still use it, but that does not mean it is not real. We have made it real by centuries of use. But it does mean that contemporary medicine should understand race as a social structure with measurable health effects and not as a biological fact of innate racial difference. So the doctors and nurses who let Jahi bleed out did not act intentionally, yet they failed in their duty of non-maleficence. They were negligent. They made a mistake. They made a series of mistakes. And this is what implicit bias looks like. This is what structural racism looks like. A series of mistakes that no one knew they were making. So note how frequently the article references the attitude of the healthcare providers towards the family. The attitude of the doctors and the nurses, the attitude of the hospital administrators. On page 33, which is page 4 of the PDF, in the bottom right-hand column, Sandra, the grandmother, says that sometimes she wonders, if the hospital had been more compassionate, would we have fought so much? So what this case displays most clearly is a failure of trust in the patient-provider relationship. Justifiable mistrust on Nyla's part led her to distrust the concept of brain death. Her distrust provoked a series of actions on her part and a series of ethical and medical debates about the concept of brain death. Yet those debates drew attention away from the initial injustice. The systemic injustice of racial disparities in health outcomes that led to Jahi's death. Okay, so that's it for the lecture. Don't forget to leave yourselves enough time to complete the worksheet because you've got to write that op-ed pitch, but I can't wait to read them. I'm sure you guys are going to write amazing things. And I hope you stay safe and sane and well in the week to come. Take care.